Hello and welcome to the 2020 Digital Health and Care Fest. My name is Pennie Taylor and it's my great pleasure to introduce Jeane Freeman, Cabinet Secretary for Health and Sport, and Councillor Stuart Currie, COSLA's Health and Social Care Spokesperson. Welcome. It's an extraordinary year, isn't it, to be discussing all things digital. This is a very different year for the DigiFest. We've got 9 days of events. COVID has brought all things digital into the sharpest possible focus. Could you have imagined this just a year ago, Jeane Freeman?
No, I don't think so, actually. And in some ways, I think it's probably quite a good idea that none of us knew what was coming. But I think what COVID has done, and it always sounds a bit odd to say this, but there have been real silver linings from the overall public sector response to the pandemic. So that's quite a wide reach, but I think it applies across the piece. And some of those we want to absolutely ensure we embed and we don't lose. So there's some about how people have worked together and behaviours and so on, but just on this particular topic, you know, it is beyond belief that we would go from 300 near-me consultations a week to 18,000 a week, and that we would now have passed the 500,000 near-me consultations with real positive feedback from both patients and clinicians alike, and widening it beyond the GP practice. So some family nurse practitioners are using it. We have consultants champing at the bit in some places, and if not across the piece, wanting to use it for their outpatient clinics. And it's not just a geographical boon, which it always was, but actually as useful in urban as it is in rural or remote settings. I think that has been a development captured out of necessity, but will make a huge change to the landscape of health, and then there are other issues in social care that I wouldn't want to lose sight of. So I think that we are in a very different place. We need to recognise digital doesn't replace human contact, but the patient response to this, I don't think people would have anticipated it would be so positive. And indeed the clinical response to it, which was always a wee bit of a, yeah, good idea, but not here. Well, now it is just about everywhere.
And Stuart Currie, is the same digital transformation happening in terms of local authorities?
Well, I think we're getting there, and I think we're getting there through necessity. I think as Jeane said there, that sometimes everybody's in favour of change, but now is not quite the time. That changed dramatically, and it has changed dramatically. I think there's huge possibilities around things like housing, things that deal with benefits, for example. There's always discussion that there's a lot of partnership working between citizens, vice bureaus and local authorities and government, and actually one of the biggest complaints you have is that there's not enough CABs and there's too many people who need help and advice with debt counselling benefits. I think it's a huge opportunity, and the thing is, I think Near Me does demonstrate that. Actually, if you try and take away some of these services from people now, that will be the bigger fight. Whereas before, the bigger fight was trying to persuade someone to use the technology. You try telling someone who actually, if they're not feeling too great, doesn't want to go for a 15-minute walk to the doctor's surgery in the pouring rain in mid-November, and they just want to pick up an iPad that they've been given, and they've got connectivity, and they're able to do that. And I think it's hugely positive. And it's not for everyone, but just because it's not for everyone should never mean it's not for anyone. And that's often been people look at the smallest example saying, well, not everybody can use it. Yeah, well, that's true. That's going to be true for everything. I mean, my mother spent a huge amount of time staring at her bank card for 10 years before she realised that she could use it outside the bank, didn't have to go inside. So, and eventually she got on with it because it was the only way to get cash.
It's incredibly refreshing to me to have both of you here engaging in this discussion together. This is integration in action. To a large extent. But do you think that we need to broaden that participation, you mentioned housing there, Stuart, Currie, the third sector, charities, all the people that are involved in responding to this, are they locked into our digital aspirations as well?
Well, I think they are, and I think it's my previous point that people are getting there, and I think it's because they can see it working. I think you can have as many presentations, as many flip charts as you want, but ultimately, when people see something working and see better outcomes, people say, well, why can't I have that? And I think that's what's going to drive out throughout the third sector and other areas. People are going to say, well, why can't we have that? Because the advantages, and it's not, actually, there's a myth sometimes it's all about saving money. Actually, it's about better outcomes. Sometimes it costs you more money, but that's okay, because if the outcomes are better, it's worth that investment because you get a longer term and a better return for individuals.
Thank you. We'll come back to the money, I think, later. But yeah, Jeane, Freeman, I mean, looking back at, you know, for instance, the digital strategies that predated COVID, do we need to refresh those now in the light of our experience?
Yeah, I think we do. And I think, if I'm completely honest, the last year has taught me a lot more about the criticality of our digital work and how that can actually deliver a more person-centered experience. So I think we do need to refresh the 2018, I think, digital strategy, and that work is underway. I think back to your earlier question about how tied in is everyone around this. I think this has been another improvement we've seen in the response to COVID so far, and we will see more of it actually as we roll out the COVID vaccine. And that is the coming together, particularly at a local level, of all those key partners. And again, out of necessity, out of a shared sense of purpose, resolving difficulties, building relationships, securing trust for what each other brings, hanging on to that is absolutely critical. And the question then is, how can our digital improvements, already made, more to come, enable more of that, so it becomes an enabler for good human relationships?
Yeah, thank you. And also, do you think digital solutions can also support the sustainability of health and social care and housing and all the other public services that are so vital?
Yeah, absolutely do. If I think about the standard, as this is going to be a health example, but if I think about the standard outpatient clinic for people who have had a heart intervention of some sort, so they might have had the stent operation or some such, they will be seen by and large by their consultant for a number of years thereafter. And generally speaking, for most people, after about the first year, the appointments are twice a year. It's usually not the consultant you're now seeing because actually you're fine. Yeah. So it'd be a clinician, but it won't be the consultant. So you take yourself along to that nearest hospital, you wait for a bit, you go in, you're out again in 15, 20 minutes. What was the point of that effort when you could have done it like we're doing it now, with a consultant sitting with all your notes, knowing how you are, having a blether with you and saying, do you know what, Pennie, you're doing great. I don't need to see you for another year, but anything at all, you know what to do. Now, that's 20 minutes out of your day, 20 minutes out of his or her day, can see lots of people, more time then to actually personally see the person who needs that individual focused contact and perhaps a bit more diagnostic tests or anxiety relieved or whatever it might be. That's sustainable healthcare, but it is person-centered healthcare. Now, we then look at social care. So again, out of necessity, quite a lot of the healthcare assessment work for individuals in care homes has been digitally enabled. Oftentimes, that has meant that we have delivered that care with a reduced level of risk because somebody isn't going into the care home. As we move forward and we have more and more testing for those visiting professionals, and for and continuation for the staff. You can see the mix here that then makes it, 15 minutes out of Mrs. Freeman's day, right? But Mrs. Taylor really needs the GP to come and see her.
Yeah.
That's
I know from speaking to patients the difference it makes to them and how much people appreciate it. How sustainable is the actual change itself? Is there not a risk that given the advent of a vaccine, let's hope, that we slip back to the way it was? Is that a danger?
I think
as well.
I think there's always a risk of this because, everyone who works in health and social care and housing in the rest of local government, we're all the same. We all slip back into our comfort zones and into the behaviours that we have had and what we know. So partly the job for people like Stuart and me is to make sure that that isn't possible, not by haranguing people, but by demonstrating how much better their job is, how much more they can deliver a quality service to people, and embedding some of this in. And actually, you mentioned the vaccine, we'll maybe come on to that later. The other side of all of this digital work is data collection and the good use of data collection. So there is an argument that successive governments for 20 years have collected more data than you can shake a stick at, but we don't actually do very much with it. Triangulating that data, stopping collecting things that we don't need, but using data to give us intelligence to make decisions is the key. Yeah. The core of that is we need to get the infrastructure right to collect the data.
Okay, well, that leads me nicely on to interoperability. Stuart, Currie, this is emerging as a really big issue. I'm taking part in a lot of conversations about it. In silos, people have lots and lots of information. It's not necessarily joined up to create a picture of the whole person. Is that an ambition for the organisation?
Yeah, I think it needs to be more an ambition. I think it needs to be an absolute requirement. I think, I think this nonsense that there's a door marked option B available to always take the easier path rather than do what you know is going to make a bigger difference. So I think the point for me, as I've said on a number of occasions, is that far too often we elevate the processes and the convenience of the system way beyond the better outcomes for the individual. And that's where we need to be. Ultimately it's about what do we do and how do we do it and how does that improve the outcomes for individuals. And that's, it's things like around, particularly around things like sustainability you talked about a few minutes ago. That's absolutely crucial. There will always be people, it's a bit like snakes and ladders actually, you make all this progress and every so often people slip back because it becomes a comfortable place to be. I think what we've learned through the pandemic is people have looked me in the eye, people who I trust and I respect, and said it couldn't be done. That was in January. And you know what? It was done. It was done by March, it was done by April. And that's been a case, and it's not because they're bad people, it's just because that's the way, it's that IBEAM Act of 1874. That's what we've had. Now, we can't, having gone through this, the gains that we've made in the most terrible of circumstances, but those gains, we can't give those up, because to give those up will actually be, in my view, I think will be a retrograde step for better outcomes for individuals. That's where we need to be. And we need to challenge, robustly and respectfully challenge those who say, actually, can we just not go back a year? Well, no, we can, because actually the huge amount of money and investment that's been made, rightly so, through the pandemic, that can't be lost, because that investment ain't going to happen every single year. There's not the money there. So we need to make sure we get the best from that for outcomes for people.
Now, you've mentioned money. I've seen figures attached to the cost of linking up all our various data sets across the public sector in Scotland. It's enormous. Would it be a justified spend for you, Stuart Currie?
Well, but I think it's going to happen. So, at the end of the day, you can either plan for it and plan the spend over a period of time through capital investment and infrastructure, take people with you, or you can fight against it. And I guarantee it'll cost you twice as much and it will be less effective. So let's just get to the radical conclusion that it works. And if it works, then why wouldn't we do it? Because we all know it's going to get, even the most miserable person that I can come across will tell you that eventually they know it's going to happen. So if it's going to happen, let's just get on with it.
Thank you. And Jeane Freeman, in a cash-strapped service like the NHS, people might say you can't spend the amount we need to spend on getting this, to the cutting-edge state we need it to be. What would your response be?
My response would be we have no choice, because there is a real direct connection with quality results for patients and residents in care homes or in care at home, in social care, regardless of their ages. And I firmly agree with Stuart on this. I think we should come to the radical conclusion: it works. It works because it enables quality results and it is people-centered. Now let's plan for this and plan it and recognise it's not going to be sorted in a year or 2 years, but could we have a 3 or a 5 year ambition about where we want to get to? And actually where we want to get to is the cutting edge, not the caught up bit, the cutting edge. How are we going to do that? But then what that needs is it needs every bit of the public sector to come together and put aside self-interest for collective interest. So none of these arguments about, I'm not doing that because we didn't invent that here. None of these spurious arguments at times about you can't have the information I've got. Really? Actually, a lot of the time, the information is owned by the person that it is about. It's their information. So if they're happy for them, if I'm happy for the information Stuart holds about me to be given to you, it's not for Stuart to gainsay me on that. It really isn't. Governance and confidentiality and proper security around data is absolutely critical. But this arm around the Jota thing that we've got away with a wee bit in response to the pandemic, in fairness, but this arm around the Jota about it's my information and you can't have it. We need to just cut through that and say nonsense. It's the individual's personal information. If they're content for it to be shared, share it.
Right, okay, that's a really interesting point, because doesn't that lead us towards, why, if I own my information, why don't I hold it and in one place and then decide who I want to see it? Now that would be turning the existing culture right on its head. Is it A, desirable, and B, possible?
I think it's desirable. If I think about me, then whatever any bit of the public sector has about me, I want to know what it is, because it's about me. And I want to know what's in my patient records. I want to know if I was working with the Council for Housing or Social Support, I'd want to know what was there, so that I can at least know what information is held about me, correct it if I think it is wrong, add to it if I think you've missed a bit, or actually you ought to know that as well about me, because that has a relevance to whatever support I might need. Now, around that, you do have to make sure that you have proper governance and you have proper control and security of that data, because I don't necessarily want you to see all of my data. Nothing personal, Pennie, but I don't necessarily. But we can do this. This is not beyond our wit. We also need to give the public a really rock solid guarantee that information that is held by public services is not ever sold on to anyone else. So I don't need Amazon to know, right, what's in my records so that they can start trying to advertise to me or anybody else. No disrespect to Amazon, but you know what I mean. People need to be confident that that information is held tightly and is not sold on, passed on beyond the public sector.
And that's absolutely vital. And Stuart Currie, in Estonia, for instance, the government there a new government came in and said, just do it. There are going to be person-held records, and they went that way really quickly. Why, can we do that here? Would be my first question to you. Would you like us to be able to do that here? Would you think there's an advantage to that, Stuart?
Well, with all the checks and balances, I think you have to be radical. I do think, actually, when people talk about knowledge, as they say, is power, and we do have to shift that power away from those who necessarily collect data to that individual. No one should have more power over the knowledge of myself or an individual than the individual themselves. That's the whole point. And with that power, you get to choose. That's the key point. I think Jeane's quite right there that, if I look up the internet, look for to buy something, it shouldn't pop up on Facebook 10 minutes later. Just happens to be an advert, and we all know why that happens. We're all a bit uncomfortable about it, but we put up with it because it's the only way to get to certain platforms. But I mean, I can't imagine an election leaflet quoting the Estonian government is going to go down that well-known council ward. But what you have to do, you have to look at the international experience where it's worked. I think a good idea is a good idea. I think it's too often the case that people say, if I didn't think of the idea, it can't be a good idea. And I think we need to actually get more experience. The good thing about the virtual world is you can travel half around the world 4 or 5 times and get that information pretty quickly, face to face, and listen to people and what their experiences have been. So I think with all the checks and balances, that's right. But I think the old adage that's about just do it, that's often been put to me as a counsellor. But the reality is, we've got more than a rationale for just doing it because I say so. We should just be doing it because it works. And the individual is better off because of that. And I think that's the game changer now. People have seen it working and they want more. But they want it to work for them, not for other people.
Mm.
And Jeane Freeman, do you think that we could do in Estonia here, for instance, and make this happen quite quickly? Because there's still disjointed information held in different places.
Yeah. So the broad principle that the information about an individual should be held by the individual, and that they should be, if not the most powerful player in the room, as powerful as anybody else in the room, I think is the absolutely right one, and that should be the principle we set out. Now, making that happen then does require what we touched on earlier, that 3 to 5 year plan to get interoperability absolutely finally sorted. But the two go hand in hand. And that would be one of the justifications, one of the cases for that level of sustained investment over time. But I've seen too many situations where an organisation has wanted to use digital opportunities to improve the service they offer and the working life of those who deliver that service. And I've then seen it completely derailed on the basis of lots of individual interests within that organisation, all arguing about their bit. So there is a kind of fundamental shift that's needed here. And that is, if we are going to have public sector interoperability, could you please park your self-interest at the door and then come and sit at the table and let's work it through. That's not to say that we are going to ignore what's important to you or what matters to you. Everyone around the table has to get something out of this. But could we stop the squabbling? Because that wastes a huge amount of money.
And time. Do you really think we could do that within 3 to 5 years?
Yes, I do.
Wow.
And the reason I think we can do it is we've got so much intellect and knowledge in this sector in Scotland that needs to be harnessed even more than it is. We have in medicine and science real interoperability in research and innovation inside Scotland, across the UK, through Europe and worldwide. That is why we're one of the leading players in precision medicine, because Scotland has a database, a secure, safe database of medical conditions and information that is a bit the envy of many others. So we know how to do this, and we know how to do it with some of the most sensitive data that you could possibly imagine. about an individual's medical condition. And research is born out of that, innovation is born out of that. Some of what we are now seeing coming through in terms of response to the pandemic is born of that. So Scotland knows how to do this. And I am a wee bit, as you know, in the Just Do It School of Government. And I think that we need to go into 2021 prepared to be sensibly radical, not radical for its own sake, but sensibly radical, to move it along fast and not tolerate some of the old excuses.
Thank you very much. And do you agree that digital is now a human right? Digital inclusion.
Yeah.
Now a human right.
Yeah, actually I do. And in fact, when we talked about the rolling out of the broadband programme and the additional investment that was put in to fill the gap that commercially was not going to be filled in, and that we would put more money into it than was coming from elsewhere in the UK, we did that on the basis of digital inclusion is as much what you should have in your home as running hot and cold running water and proper heating.
Wow.
It's part of it. And to think otherwise is mad. That's the way people increasingly are part of the world, including older people.
Yeah.
It's not the prerogative of the young. I'm no spring chicken myself, and I use it a great deal, but older people do all the time too.
And Stuart, that's terribly interesting. I'll ask you the same question, but I'm going to add to that as well. You know, if you do agree that digital inclusion is a human right, you know, how can we ensure, for instance, that the new homes that are being built in Scotland's communities are able to support people with not only what exists digitally now, but what may come?
Yeah, but see, I mean, I agree that it will happen. The reason it will happen is because we've already done it in other areas. On renewable energy, now 15 years ago, when I first became a councillor, no houses were being built with solar panels built into the roof. Nobody was putting in renewable energies. What happens now? Every new housing estate you go to, it's not just the social housing, it's everyone's housing to have the solar. Why is that? Because it's a tenth of the cost to do it when you're building a house anyway. That's the point. People are already having points put in next to their garages or their houses so they can charge their electric cars if they want to have that fitted to their house. So that's been driven not just by necessity, because there's a demand for it. And actually, it's amazing because it's one of the strange things when I have my advice surgeries and people come, particularly older people, I'll say to them, I'll say, are you on the phone? As if somehow it's some miracle that people are on the telephone. And I blame my mother for that, because it wasn't unusual for people not to be on the telephone. And yet nowadays, everybody's on. Now, hardly anybody uses the phone in their house. Everybody's got a mobile. The only reason they've got a telephone line is for broadband. So actually, we get there incrementally when we start saying, are you on internet or not? And actually, the last time I bought an iPhone, when I went to the shop in Edinburgh, I went up the stairs and have these knowledge bars. We have all these people who turn up, a dozen people at a time, to a big screen to learn about how to use their iPad or their iPhone or what have you. And I swear there's 3 or 4 knowledge bars and groups going on, and there was nobody under 65. They were all everybody was trying to get the best out of this thing they'd invested in, called an iPhone or an iPad. And why is that? Because they liked what they had. If they had sight problems, they were able to blow up newspapers to a huge size so they could still read the newspaper. And for a lot of people, that was an enabler. It wasn't a problem. It was an enabler. It wasn't a barrier. It was something they welcomed, because without that, they had no option but to stop reading newspapers.
Yeah. Thank you. And, if we're going to refresh or create a new digital strategy for Scotland, bringing in all the learning of the past year and looking to the future, how can ordinary people contribute to that? Can they? Because it would be really interesting maybe to tie them in to the development of a strategy as well. Yeah, Jeane Freeman.
Yeah, I actually, it's a really good question, because I think we should do it that way, and I think there's no reason why not. There's absolutely no reason why not. And I don't mean the the consultation document that goes on a website, and we tell folk about it. You know, we did a lot of enhanced consultation around social security before we even drafted a bit of legislation about it. And we used experience panels, they're still running, to inform policy development. We used third sector organisations who organised lots of groups around the consultation document. So we did produce one, but then different third sector, voluntary, community, national third sector, local ones, local authorities, lots of different organisations got involved. They brought people together. They went through the bits that were most interesting and relevant to them. They collated their views, and we ensured that there was a core set of questions in every one, and somebody from Scottish Government to take a proper note, so that that could be included as evidence to the consultation, as legit as anything that might come in via an email. Now, that's how the two things happen as a consequence of that. You are genuinely engaging with people. If you want it to be a person-centred strategy, it is person-centred in its production. But also, people point things out and tell you things, and they make it better. They make it a better thing. So it's win-win, whichever way you do it. It takes effort and time, but it is so worth it.
Thank you. And Stuart, Currie, you know, we've talked in the past about trust, and this is a potentially very contentious area when it comes to data security and who gets access to information, and people believing that and going with it. Do you think that involving the public in shaping this is one way of consolidating trust or even building it?
Well, I think it is, because the public, they're the boss. They're the employer. You know, they're the people who determine who makes the decisions. They're the people who determine what's the best way forward. And actually trusting people to tell you what works for them. I've got tired over the years of everybody in organisations and systems telling people this is what you're going to have because it's going to make your life better. But actually, if you spend 10 minutes asking someone, you tell us the top 3 things that are going to make your life better and going to be a real help to you, you'll get a different answer every time. And actually, the fear of asking people is they might ask for something you can't afford to pay for. In my experience, when you ask people, they come up with something A, that's probably more cost effective because you get it right the first time round, but B, it's more cost effective because they've cut through the nonsense, they've cut through the theory, they've got to the reality of what has worked for them and their family. And there is nothing like someone having the experience of something working for them and their family. And the other thing is they become ambassadors for change, because they will stop someone in the high street, what used to be the bingo hall, they'll stop people, all their friends, and say, I'm using this, you should use that. That's how you build confidence. You don't build confidence by, you know, a glossy leaflet and a chat with a few politicians, dare I say. You build confidence by people using things for their benefit that they see is going to be a good improvement. And they'll tell people, and they'll be your best ambassador day in, day out, because it's more believable.
Now, and of course, the same applies to staff. Jeane Freeman, yeah,
it does. It does. Whatever is developed in all of this has to, like I say, it's like my earlier point about everyone who comes around the table has to get something from it. It's like any negotiation, you know, any way in which you're going to make change and improvement and sustain it. Everyone has got to see a bit of what's in it for them, right? That's we're all like that. How's my life going to be made better? How's my job going to be made more enjoyable, easier, less hassle, whatever it is? So staff need to be part and parcel of this too, because again, the staff who actually deliver a service, they are the ones who know how you make it better, what would help them. It's the same question to them as Stuart is saying is the question to the receiver of a service. What would make it better for you? They'll tell you.
Thank you so much. Now we're coming towards the end of our discussion. I could talk about this for days, but we'll draw a line under it very soon. But Jeane Freeman, you're changing your role in the near future. You're going to be standing down from the Scottish Parliament at the next Holyrood election in May. What advice would you be giving to the next person to occupy the Cabinet Secretary role when it comes to digital development?
My advice would be capitalise on what has been achieved and be radical in trying to embed both that and future improvement. There are often in political life or in life generally, there are golden moments. And I think by the time of the next election, my fervent hope is that we will have vaccinated the vast majority, if not all, of the population of Scotland. We will be dealing with coronavirus in a different way. And it's a bit of a golden moment. And you've just been elected and you're the new government. And frankly, you've got 5 years to make a difference here. So make the most of the first 2 years. Make the most of it.
Thank you. And Councillor Currie, what will your focus be in the, say the next year? Let's look to the next 12 months.
Well, I think it's to grab with both hands the opportunities. I'm a hugely optimistic person. I believe that if we trust in our instincts and trust in the talent. I mean, Scotland is bursting with talent. Everywhere you look, there are people who, through pandemics, who have risen and come to the fore that we would never have thought about, and they've come there and they've really delivered for people. So I think we've got to trust people, build those good, solid relationships, and if we do that, actually, we're in a real chance of making not just change, but change that's sustainable. And if we can do that, it'll be better for the people we serve.
Thank you so much. As somebody that has been around this debate for a long time, I can tell you that for the first time I feel quite excited about what we might actually achieve. I'd like to thank very much Jeane Freeman, Cabinet Secretary for Health and Sport, and Councillor Stuart Currie, COSLA's Health and Social Care Spokesperson.
Thank you
so much.
Thank you.